Afternoon, everybody. This is Sarah at the City of Phoenix Benefits Office, and welcome to our open enrollment information session for 2022 open enrollment. Our open enrollment is going to begin on October 18th and go through November 12th. So we are going to discuss today all of your options that you have to, during open enrollment would be the time to add or remove dependents, as well as make changes in plans if you choose to do so. We're going to discuss all of those options that are available to you. I do have two great co-workers, Jeff and Kate, here to answer questions during the presentation that you may have. So I do ask that you enter those in the questions and answers box, and they can answer questions throughout the presentation, and we will have plenty of time at the end of the presentation to answer additional questions as well. We do ask that you don't ask anything too personal, so if it's about a specific claim or condition for you or your dependents, we would ask that you reach out to the benefits office directly for that, so you're not sharing too much personal information. So we'll go ahead and get started, but we have mailed out some postcards, and we have our website up and running for information regarding open enrollment and your options during open enrollment. There are these open enrollment information sessions. We will not be having any in-person meetings this year like we have in the past, but we do have these live question and answer sessions, and we are always available in the benefits office to answer questions as well. You will start to receive emails notifying you of open enrollment and when we're getting towards the end of open enrollment as reminders. And then when you log into eChris, there will be some additional messages to remind you as well. We do have a couple more of these information sessions available. So you can see on the 11th and 13th, if you want to attend another one, or you have a spouse that would like to attend, or a coworker wants to attend, please let them know. There are a couple left. And we will have a recording of one of these sessions available on our website at some point as well. So we're going to get into all of your coverage options. So we have the same great plans that we are currently offering and you can enjoy at this time. So we'll discuss all of the details on that. We do have one flu shot session available left, again, available at Union Hills Service Center on October 13th. So if you are interested in going to Union Hills at that time, if you're available to get a flu shot, you would be entered in a drawing for a Target gift card as well. So our wellness incentive is still available. So you can, if you or your spouse enter and complete the requirements for the wellness incentive, then you can receive $40 a month. If you and your spouse complete the requirements, then you can receive $60 a month. So our wellness incentive requirements, as you may remember, the last couple of years due to COVID and it being a little difficult to get in to see our providers, we did waive the primary care visit or wellness visit, and you only needed to complete the health risk assessment in order to receive the wellness incentive. So now we are going back to the requirements of having both completed in the same calendar year. So your requirement is to have your wellness visit with your primary care physician or primary care visit for an in-network doctor, and then take that information and complete the health risk assessment, or what they're now calling sometimes the real age test. And you will complete that online with the information and the biometric data that you received during your visit with your PCP. So between now and November 12th, which is the end of open enrollment, you would need to have your primary care visit if you have not already done so in 2021 and complete the health risk assessment. Both of these need to be completed in the same calendar year. So the requirement, the deadline is the end of open enrollment to have both completed, and that guarantees that you would receive the incentive starting in your first paycheck of January in 2022. So if you are running a little behind, that is okay. You can still complete both of your requirements, which is the wellness visit and the HRA health risk assessment online. However, that just might not guarantee that you get the incentive on your first paycheck in 2022. So Still go ahead and complete both of those to get your incentive going forward. But keep in mind, if you have a visit in December and don't complete the health risk assessment until January, that's not going to count. They're going to need to both be completed in the same calendar year. So you can wait until 2022 to do both, but you have to do them both in the same calendar year. But we have the same great full-time designated city representatives from our carriers. It's Maggie Perez from Banner Aetna, Michelle Walker from Blue Cross Blue Shield, and Kim Baker from Elixir Pharmacy Coverage. So they are available to answer any questions you may have, any claim issues, any specific questions about coverage. They are always available to answer your questions as city employees. And obviously we are available in the benefits office as well. You can see here the medical plan premiums for 2022. On the far right column is what is going to be deducted from your first and second paycheck of the month. So we have our same great Banner HMO plan available, the same broad and performance networks that are currently available. There is an unlimited lifetime maximum benefit. There is no deductible on the HMO, and they do have the 98.6 virtual care option. So again, you have both networks available to you under the HMO, which is the performance network and the broad network, and the same 24-hour access to nurse support, as well as the 98.6 virtual care. The virtual care is an app that you can download on your computer, your phone, and have a virtual meeting with a virtual appointment with your provider or a provider. And it is a very convenient option to have that virtual option through Banner HMO. So depending on the network that you are going to be in, so you can pick a provider. Both networks are available to you. You don't have to pick and choose, but you would pick a provider within one of the networks, and depending on which network they are in would depend on the copay that you are paying and the type of visit for that claim. And again, the 98.6 virtual care option, there is no copay for the virtual care option. So again, you just download the app. Can have access to meeting with a provider online, and then they can call in prescriptions for you. If you aren't sure if you need to go to urgent care and emergency room, it's a great option to talk to somebody about your symptoms and what's going on with you or a dependent, and see if you maybe should attend visit in urgent care or your doctor directly. And then our Blue Cross Blue Shield PPO plan is still available. It has the same $300 deductible per person per family up to 3 or more. And then once you've met your deductible, you have your 20% in co-insurance for an additional $600 per person. The pharmacy coverage is co-pays under the PPO, and you do have an out-of-network coverage option on the PPO, just as you do today. And we still have our great Blue Cross Blue Shield Savers Choice Plan. So it's the same large national network as the PPO. However, it does not have out-of-network benefits like the PPO does. The deductibles are staying the same. So your single deductible is still $1,500 per year and family is $3,000. It does still allow for the health savings account with the city's annual contribution. It is the lowest premium cost, what's being deducted from your paycheck. If you are currently enrolled in this plan and you are contributing to your HSA and you wish to continue to do so, you do need to log into ECRIS and make that election for 2022. So your contributions to your HSA will not roll over automatically. If you choose to continue to contribute to an HSA, you would need to go into ECRIS during open enrollment and make that election for 2022. And your HSA contributions, you are going to be picking an annual amount that is going to be divided over the 24 pay periods in 2022. So the city contribution to our HSA when you are enrolling in the Savers Choice Plan is more than half of our deductibles. So for single coverage, they will contribute $1,125, and for family coverage, they will contribute $2,250. The contribution is deposited into your HSA, and that will be effective. You will see that in your account the first paycheck in 2022. On the Savers Choice Plan, there is a preventative drug list option. So if you are on a preventative drug such as a high blood pressure, cholesterol, blood thinners, something you're taking on a regular basis, they could possibly be on the preventative drug list, which would be a $5 copay and bypass the deductible completely. So it would not go towards your deductible. And Blue Cross Blue Shield has their virtual option for virtual care, and that is through Blue Care Anywhere. So there is no copay for the PPO, and would just be a $20 copay on the Savers Choice Plan unless you've already met your deductible, and then it would be covered at 100%. So it's the same type of virtual care, an app that you will download, and you can have that virtual care option with a provider online. The health savings account is still going to be provided through Health Equity. So it is under IRS regulations. So the city will contribute to your HSA on a tax-free basis, and you can contribute to the HSA as well. Your accounts, your funds in your HSA account do grow, so they roll over from year to year, and there is still a free debit card available to utilize those funds. And once your account grows to a certain amount, I want to say it is $2,000 at this point, you do have investment options through Health Equity as well. There is a monthly administration fee that the city pays for us when we are active employees and enrolled in the Savers Choice Plan. If you were to terminate or retire or switch plans, the city would no longer pay that administration fee. That would be charged to your HSA account at that time. But with your contributions, you can start, stop, and change your contributions at any time during ECRIS throughout the year. So there's no life event required for that change. And then there are the IRS regulated amounts of your annual contribution that you can contribute to that account. So the benefit of our HSA is the tax savings. So any money that you contribute, the money the city contributes, is tax-free. You do not pay taxes on any interest earned, and you are not paying taxes when you utilize those funds either. The maximum contribution for 2022 for employees is $3,650, and for family coverage is $7,300. If you are over the age of 55, you can contribute an additional $1,000 per year. Keep in mind that contribution, the annual maximum contribution, includes the city's portion as well. So the maximum would be your contributions and the city's combined. But again, you can set up your paycheck contributions through ECRIS and change them as often as you need to throughout the year. And then you can sign up and log into your Health Equity account online, so you can pay your claims and see your account balances and view all of your information with them. So we still have our FlexWrap option. So there is your FlexWrap option. You can utilize if you're on the Savers Choice Plan. However, it would be limited to vision and dental, because you have your HSA for medical and pharmacy. And but you have your health savings account option as well. So if you're on the HMO or the PPO plan, the FlexWrap plan can assist with that tax-free money to help pay for medical expenses, but there is quite the difference between the two. So some information about that on your HSA. It is not a use it or lose it. Your money rolls over from year to year. You can start, stop, or change the contribution amounts. The HSA contribution limit is set by the IRS, but the limit is higher than what you can contribute to a FlexWrap account. And then documentation is rarely required. So on a FlexWrap account, you would be picking an annual amount, and that is the amount that you cannot change that amount unless there is a qualifying life event, such as a divorce. You could reduce it, a marriage, you can increase it, and so on. Otherwise, you if you do not utilize those funds by the end of the year, you would lose it. The contribution amount is a little bit lower as mentioned. The 2022 limit is not yet available, so that information will be provided at a later date. And then documentation through FlexWrap is almost always required. So even if you use your debit card with your FlexWrap account and pay for something at the pharmacy that qualifies, you're likely still going to need to provide documentation for that charge. But there are some other IRS regulations when it comes to our health savings account. So only your taxable dependents can utilize the funds in your HSA. So while you might have a non-taxable dependent on your coverage and they can still utilize the medical coverage, you would not be able to use your HSA funds to pay those claims. Also, if you are enrolled in another plan, so maybe with a spouse or if you're a dependent of somebody else's insurance, both plans would have to be high deductible health plans in order for you to have the HSA with us and have the HSA contribution. So if you were both enrolled in high deductible health plans, then you could still have an HSA contribution and utilize those funds. Also, if you are covered by Medicare or Medicare eligible, you would not be able to contribute to a health savings account. And then a qualified domestic partner is not considered a taxable dependent. So if you have a qualified domestic partner on your coverage, while they can utilize the coverage, you would not be able to use your HSA funds for their claims. And if you have questions, please reach out to Health Equity. They have a great customer service and would be happy to answer any specific questions about your situation and whether you are allowed to contribute to an HSA. On our Savers Choice plan, this is a breakdown of if you are enrolled in the single coverage, you can see the savings when you're enrolled in the Savers Choice plan. So there's your annual deductible of $1,500 and the city's contribution of more than half of that deductible to our HSA, as well as the comparison in premium between the Savers Choice plan and the PPO. And if you complete the requirements for the wellness incentive, you can save an additional $480. And then a comparison for the family coverage. So keep in mind the wellness incentive applies to any plan. So even if you're enrolled in the HMO or the PPO, the wellness incentive is still an option for you. So we do have a couple more of our information sessions on the health savings account. So if you are not enrolled in the Savers Choice plan and currently have the HSA, you can attend the next available class information session is the 12th of October. So you can get information about whether this will work for you and how it works. If you are currently enrolled and you want to understand more about your HSA and how to maximize those accounts or how to invest your HSA funds, then there are some information sessions for that as well. And you can see the link on the bottom left. You can sign up for those information sessions. So we still have our great Elixir prescription drug benefits in 2022. There is retail pharmacy options as well as home delivery. So you can see that we have a huge, very large national network of pharmacies. And then if you signed up for your home delivery, you can also save because you would receive a 90-day supply for a 60-day copay. So your home delivery can save you in copays. With our prescription drug coverage, if you are on a maintenance medication, then your requirement to fill maintenance medications would either be through home delivery, or if you prefer to get your 90-day fill at the 60-day copay, then at a retail pharmacy, then you would be restricted to CVS, Target, or Fry's. So that's just for maintenance medications. For one-time medications, you can go to any in-network pharmacy. But for maintenance medications, if you want to fill retail, it would be through CVS, Target, or Fry's, or you can choose the home delivery option through Elixir. So there is a member portal with Elixir. If everybody that has medical coverage with us has pharmacy coverage through Elixir. So you can visit the member portal and view your claims. You would have access to your ID number, the pharmacies that are in network. You can transfer medications, request reimbursement, and so on. And then we have our great Elixir representative, Kim Baker, as well. If you guys have any issues or questions that are very specific to Elixir, she's always available to answer questions as well. So FlexWrap in 2022. We have our contribution right now, it's set at $27.50 for healthcare costs, and it's the same for daycare at $5,000. We're waiting on the if there's a change in that contribution, which obviously we would let you know if you have questions on that, but you still have the option for your FlexWrap healthcare. And so this would cover most healthcare expenses for you and your dependents. If you do have, again, the HSA, then FlexWrap, if you have an HSA, your FlexWrap could be utilized for vision and dental only. And then that amount is, the annual amount that you choose is divided over 24 paychecks and taken from those 24 paychecks. On the FlexWrap, the amount that you choose for the year of 2022 is available for reimbursement right away. Whereas on the daycare, which is daycare expenses incurred for children up to the age of 13, you would provide documentation. However, keep in mind the annual amount that you choose for daycare is only available for reimbursement as you contribute to it. You can submit claims for more than what you've contributed, and then they would start to reimburse you once you have reached that balance. There are some grace periods due to COVID and having some issues utilizing medical funds and expenses. There was a balance transfer for FlexWrap for 2020, and there is one for 2021 as well. So if you have not been able to utilize your funds due to some, outside of your ability due to not being able to see a provider, there is an option for a balance transfer, and you can reach out to Connect Your Care for that information. We still have our great Davis Buy-Up Vision Plan available in 2022. So it is your option for glasses or contacts every year. They do have a large national network, includes a lot of, there are a lot of providers within the network, but then there's also the very well-known ones such as Costco, Nationwide, VisionWorks. They have an amazing customer service. So feel free to reach out to them if you have specific questions or need information about providers that are in their network, and you can visit their website as well. You can see the coverage options is a $10 copay under this plan, in addition to a frame allowance of $175, as well as $175 contribution or allowance for contacts, and then most lenses are covered in full. So I do find that the Buy-Up Vision option is a great benefit if you get glasses or contacts every year and you're enrolled in the Saver's Choice plan. I do recommend the Davis Vision, or it's a very good option for you if you utilize the vision funds and you're on the Saver's Choice plan. But it is a great benefit in addition to our basic vision through our other medical plans as well, because the copay is lower and their contributions to frames and contacts and lenses is quite a bit higher than our basic vision available through our medical insurance. And then we have the same 3 great dental plans through Cigna. So your dental HMO option, that is a smaller network. You would choose a provider within the HMO network. The implants would not be covered. And then most of your preventative, such as cleanings and annual x-rays, are covered at 100% under the HMO. And then any additional benefit or any additional services would be according to a fee schedule. On our dental PPO, you have a large national network. There are also out-of-network options. There is a $2,000 annual benefit under the PPO, and then a $4,000 orthodontia lifetime benefit. And then our dental PPO plus is just like our dental PPO. However, there is an additional $1,000 in your annual maximum benefit and implants are covered. You can see the premiums here for our dental in 2022. There is a small increase in the family coverage, and but if you're single dental coverage on the HMO or PPO, it is still covered at 100% by the previous year. Optional life insurance is another option you have during open enrollment to increase any amounts that you choose to. So during open enrollment, you have the option as an active employee to increase your insurance by usually 10 to 20,000 if you are under 150,000 in optional life insurance. So for 1 year only, we are offering our life insurance company is allowing up to $50,000 increase without underwriting, as long as you are under 150. So if you currently have optional life insurance and you want to increase during open enrollment, you can do so anywhere from 10 to 50,000. Once you have hit 150,000, then any amount above and beyond that would require underwriting, or as they call it, evidence of insurability. And then the website, if you are applying for evidence of insurability because you're electing an amount that requires it, you can see the website for life benefits, and you will need the group policy number and the access key. So be sure to take a screen print of this or write that down. Now for spouse coverage, if you are currently enrolled in spouse coverage and they are under 50,000 in coverage, you can increase by 10 or 20,000 up to that 50,000. If your spouse is not yet enrolled in optional life insurance, or you want more than 50,000 for a spouse coverage, then underwriting would be required for a spouse. And then the child dependent optional life insurance, there is no underwriting for children. It is one policy for every eligible dependent, meaning any child under the age of 26. There's no requirement for them to be on any other coverage, but if you have children under the age of 26, you can enroll in dependent optional life insurance, and that is available as one policy for every child under the age of 26. Sorry, real quick, I just did want to mention that the child coverage, dependent coverage, I do highly recommend it. The maximum policy is $25,000, and it is $2.50 premium, and that will be the max amount for dependent children. So that would be your opportunity to enroll. Another point I wanted to make is your dependent children, when they are coming off of your coverage due to max age, which is 26, their coverage would end at the end of the month in which they turn 26. Medical, dental, vision would all end automatically. If you have dependent life insurance, that will not end automatically, because we don't know if you have other children under the age of 26. That is not something that we would terminate for you automatically. So optional life insurance is something that you would have to waive if all of your children are under the age of 26. Or I'm sorry, if all of your children are over the age of 26. And then we have our same great two AROG legal insurance plan options. So the same national network available of attorneys for your legal needs. And there is the full plan and the value plan. So you have a network of attorneys available to assist you with any paperwork or any issues, such as a car accident or an issue with a neighbor and so on, as well as preparing things like wills and estates. And then the full plan option includes all of that, as well as ID theft protection for you and your eligible dependents. And there is some tax preparations, and they also include trust preparation under the full plan. You can enroll again through ECRIS for the legal insurance plan. Coverage will roll over if you are currently enrolled in a legal plan. But if you wish to enroll or waive that coverage for 2022, you do need to make that change in ECRIS during open enrollment. Pet insurance is still offered through MetLife. Enrollment is directly through MetLife, so you will be contacting them directly, let them know that you are a city employee and interested in the MetLife pet insurance options. They do have a couple different plan options for you, but your premiums would need to be given to you by MetLife directly because they can change based off of the type of animal, age of the animal, etc. And then we still have the employee loan program through TrueConnect. So it is a high interest loan program available where your repayment would be through paycheck deduction. But we do see people utilizing this for emergency purposes. So maybe car repairs and things like that. And because you can pay it back through your paycheck and there's no penalty for prepayment, you can get that paid back as soon as possible if you needed that for emergency purposes. And you would be contacting TrueConnect directly to request the amount for your loan and how to set up your paycheck deduction for repayment. Our deferred compensation is still being handled through Nationwide, and you can see, depending on your benefit category, what the city is contributing to your 401A plan. There were some recent negotiations, so that changed it back in July, and that contract is through June of 2023. So based off of your benefit category, what the city is contributing. And then you have your option to contribute to your 457 plan options. So your regular 457B and your Roth 457. You can start, stop, or change those contributions at any time as well. And you would do that through the Nationwide website or by contacting them directly. But their website is phoenixdcp.com. So you can contact them. They have a great financial advisor available. If you want to speak to them about your accounts and your investments, any financial planning options can be discussed with them. And then we do have our currently going on through open enrollment, our City of Phoenix annual virtual benefits fair. So if you would like to visit the phoenixdcp.com website, and you can explore those resources through that. You could also scan the code with your phone on this screen right now, and that would take you there. But if you are interested in learning some more about your deferred compensation accounts and you have additional questions, that would be a great resource to help. And then who can be enrolled in our plan? So again, open enrollment is the time to add or remove dependents outside of a life event. So documentation is still required. If you were to add a dependent during open enrollment, you would still have to provide documentation to prove they are an eligible dependent. But your legally married spouse, a qualified domestic partner, biological stepchildren, adopted children, or legal guardianship, they're all qualified dependents. So now would be your time during open enrollment to add or remove them. And again, you would still have to provide documentation, but this is the opportunity to add or remove them without a life event throughout the year. And then in ECRIS is where you are going to be making any changes or viewing your current information. So you will enter into ECRIS self-service and click on the benefits enrollment page, and your open enrollment as of October 18th will be available for you to select and look at your current coverages, as well as making any changes that you find necessary during open enrollment. I would like to mention that open enrollment is a great opportunity to view all of your life insurance beneficiaries. So even though you can change your life insurance beneficiaries as often as you'd like throughout the year, it's always a good time, just a reminder to view your life insurance beneficiaries and make sure they are who you think they are. And then if you are getting ready to or thinking about retirement, there are a lot of options for viewing what your options would be in retirement. So there are retirement classes offered throughout the year. If you have questions, please feel free to reach out to the benefits office for that information. But there are quite a bit of retirement options whether you're Medicare or non-Medicare at the time of retirement. We do meet with you individually in benefits at the time that you do retire. But the classes are a great resource to understand more what your benefit options are going to be at retirement. And then I cannot stress enough how important it is to reach out to the benefits office if you have questions. So your I know coworkers and supervisors always want to be very helpful in giving you information about benefits, but they can change quite often. And so because we are the experts at the benefits office, I do recommend if you have benefit questions to please reach out to us so you can view our website. Or if you have questions, you can email us at benefits.questions@phoenix.gov. And that is monitored on a regular basis, and it will be distributed to the best person that can answer that question for you. So I am going to go ahead and stop there. That is the end of the presentation. However, we do have people answering questions in the questions box. Feel free to add questions continuously, and we will stay online and make sure all of your questions get answered. If something were to get missed by chance, please, or if you ask something very early on and you would like to, haven't received an answer and would like to ask that question again, that is fine. But we will stay on as long as we are receiving questions, as long as we can. But again, great resource at benefits.questions@phoenix.gov if you think of something later on or have additional questions after the end of this presentation.